Again, on the expert at her side, excellence is not a skill, it's an attitude. For that matter, everything, whatever we do, whatever we try to do it, it's not one of the thing, but it is like that. And the future belongs to those who learn more skills and combine them creative ways. Really, nowadays, I'm really impressed with all the young girls who are doing, young girls and boys, who have just after passing the postgraduate degree of OBGYN, and they don't say they want to do some fellowships, they want to do some courses, they want to, before joining the practice, they are trying to do and trying to learn many more skills. And that's very important, because the number one thing which I have learned, that the experience is more important than any other thing. So nobody ever mastered any skill except through the intensive, persistent and intelligent practice. All of us know about it. Then, now how to shaping lives and shaping confidence. Supporting patients with the creditable information. See, whatever the course you are doing, at the end of the day, our patients are very important. And the patients with the creditable information, it's our part of it. And this program is patient doctor-centric program with informed choices. Learning curve and a gradual popularity today is a key challenge in our learning techniques. Will help doctors to practice, popularize and prescribe with we understand the importance of the procedure. I'm sure whenever we talk about the learning curve, and I guarantee each and every one of you, it has a less learning curve time than any other glamorous surgeries, either by laparoscopy or the robotics or anything, because the learning curve in a vaginal surgery, it's a very natural one, and we can learn smartly, fast and very important. And we all are there, as I'm so proud of you, all of you today, 77, 80 participants today just joined to listen the introductory section. It's a really getting gradual popularity. See, each and every one with a two speculum, with little instruments, we can do vaginal surgeries. But for doing the laparoscopic surgery, I'm not against of laparoscopic surgery or not posing anything that the laparoscopic surgery is like that. But to learn the vaginal surgery, it needs a less learning curve, and it's a really gradually popularity today in learning techniques and helping everything. In present scenario, again, the glamorous laparoscopic surgery, let us make vaginal surgeries more glamorous and then make it as an inspiration. It should come from performing concomitant surgeries. So it's my aim about this. Now, another thing is shaping lives and a confidence. Not is the time of gynecologists who want to be progressive and pass the benefits of what is the best to the patients, and not perseverance with opening the abdomen will not abnormal ever not need. So it's a little thing that if we can do through vagina, why to choose the route of, why should go to the abdomen? This is another thing. And at the end of the course, we will be able accurately to evaluate his or his surgical skill based on the surgical outcome and reducing the learning curve for the new surgical techniques and subject of discussion. Now, how to connect and collaborate. This is another important point. What we learned yesterday, what we are doing today, and what is going to be done tomorrow. It's another important point. Because what we have learned today is a basic, but exactly what we are doing today, actually, presence is very important. But if we want in our future, should be made with some good ways, which is for the future everyone. So these are then, and adding an extra edge, vaginal surgeries offer great advantage of less morbidity, reduced operating time, less hospital stay, keeping abdomen intact and reducing heavy physical as well as economical financial burden. It's very important. Again, vaginal surgeries from basic episiotomy to removal of the giant fibroid to be removed through is a state of art. And I'm sure just putting a simple episiotomy, what suture we are using, how to clean it, how to make it, how to suture it, how to take care of that episiotomy. The basic episiotomy is also included into the vaginal surgery, I'm telling you. And it should be done with a nice way. And once understand the anatomy and the pelvis and the tips and tricks of the basics of major surgery, it will make curious to perform it by your own. Since few as Bapat, apart from episiotomy, what are the vaginal surgery? Bartholin cyst excision, cervical circulage, and there was an era, laparoscopy. Before that, gynecologists were comfortable with abdominal surgeries. But today it's an era of vaginal surgeries and we are all propagating it. Being ignorant is not much as a shame as being and willing to learn. This is by the Shirish Shetty, is another, our own big person who has wrote like this. So I just liked it and I am using this as quote. And vaginal surgeries have two divisions, we can say. So it's not like only course. This course will basically have two major distribution, we can say. One is all about hysterectomy session. So all it can be non-descent or anything. And another is non-hysterectomy session. A non-hysterectomy session, it includes everything, whatever comes. So vaginal surgeries is not teaching you people all about hysterectomy only or teaching you any other thing of the non-hysterectomy session. So vaginal hysterectomy, first we will cover it. In that, we will, in our course, we'll have all the knowledge about the applied anatomy of the female genital tract. From the terrain of known terrain to unknown terrain, we should know everything. And general gynecological examination, gynecological regions, pre-malignant regions of the genital tract is very, very important before doing anything. Now, we should all know the history of vaginal surgery. So many people, especially in our country, also in outside, they have worked and they have toiled to make vaginal surgery popular. And there is a big history. It will be also in a course. In vaginal hysterectomy, it's a very simple, again, integration, contraindication, how to do the preoperative assessment. We have already made some of the scorings of the hysterectomy scoring so that we should not be able to do the unindicated hysterectomies. And that is, the scoring is called the hysterectomy score. It depends on the signs and symptoms. And that score will also be taught. Then how to assess the vesico-uterine pouch, how to reach the recto-uterine pouches. Now, what to do with the genital prolapse. Now, anterior and posterior apical reconstruction and with and without blasters. This all will be included into the surgery. In vaginal hysterectomy, in a nulliparous patient, with a big fibroids, with uterine debulking, it's a really in a fashion also. And it's a really life-saving and very important, all those things. Now, in a hysterectomy, in a previous abdominopelvic surgeries. Now, trial vaginal hysterectomy. Are we able to do that hysterectomy and a trial vaginal route? And contraindications of the abdominal route. I'm just adding one point over here. When I started my practice in 1992, although I started my practice in 1992, there was a fashion of doing all the surgeries only through the abdominal hysterectomy. Was so popular. And patient used to come to us for the abdominal hysterectomies only. But as I was learning, I wanted to do the vaginal surgeries. I wanted to do the non-descent vaginal hysterectomy in those times. So I used to deliver all the uterus from the down and give the small incision. Just I am telling on this is really a documentation. Just put a scar onto the abdomen and to tell the patient that I have done your abdominal hysterectomy. I'm telling you it's very loudly and clearly. To learn many things, we have to do many things. So any other contraindications into this thing? Now, vaginal hysterectomy along with oophorectomy at the time of hysterectomy will be also in the course. Concomitant salpingo oophorectomy, adnexal pathology with vaginal hysterectomy. We can do the subtotal vaginal hysterectomy if needed. Difficult vaginal hysterectomy. Difficult vaginal hysterectomy means the rotation, the large uterus can be adherent to the abdominal wall. There are so many things. So general examination also will be there to find out what are the chances. Then the hybrid approach for the difficult vaginal hysterectomy. So one should be very much clear. If we are not able to do the difficult vaginal hysterectomy, what will be the hybrid approach? And in high risk women, high risk women is day to day, as in my practice, because my practice of doing hysterectomy is long. So I am getting more high risk women. The high risk women with diabetes, they are having some medical problems. Sometimes they have some DVT or many more things, or the obesity, nulliparous. So these are also the high risk women are there for the vaginal surgery. And in the vaginal surgery, we should know the simplified techniques of the hysterectomy. One day hysterectomy, again vaginal hysterectomy will be also the part. Now again, there is a big question about the malignancy related to vaginal hysterectomy. It will also be taught. And the vaginal hysterectomy for the carcinoma endometrium, it's becoming a very important removal of the uterus, and we find out that's the endometrial carcinoma. But all the data and everything are suggesting that we can do the vaginal hysterectomy for the carcinoma endometrium if it has gone not beyond the myometrium, and there is all the things. So these are also into the course. Then associated urethral sphincter incompetence, it's also in the course. And associate non-gynecological surgery, place of sacrospinal colpopaxy, hysterectomy and sexuality is also important topic. And sometimes how to do the examination under anesthesia in a vaginal hysterectomy. Then ligatures, sutures, what are the sutures we are using? What are the ligature system we are using? What is the cautery? What bipolar cautery and how the vessel sealers are being used? What is the laser roll of razor? There are many more things which will be also included. And the evolution of the injuries is also important, and whether there is a fistulas or anything, ureteral injuries or the bladder injuries, the intestinal injuries, it's all will be included into it. Now, the important thing in the hysterectomy, how to position the patient, what is the surgeon's comfort to increase visibility of the deep inside vagina is also be included into the course. And there is always what modification into it. But in recent time, we can talk about the V note is also coming. So through the vagina, we can put a V note and do many more things. It will also be included into the course. And very important again is the complications, mortality, morbidity is also included.